Welcome to this edition of Community Health Matters. February is Heart Health Month, and on today's show, we have experts from Tri-City Medical Center to talk to you about how you can have a healthier heart. Our first guest on today's show is Dr. El-Sherief, a cardiologist with Tri-City Medical Center. Thanks for joining us, Doctor.
Thank you for having me.
I understand you're a member of the American Heart Association.
I am.
Tell us how that helps your local constituency here in North County.
What's really special is our new partnership with AHA in Tri-City. The two entities share a very common goal, and that common goal is to prevent heart attack and stroke. What's really special is we'll now have funding resources for North County residents and really bring about change. And that change is going to be empowering our individuals and our residents to take better care of themselves, and so that we can prevent heart attack and stroke.
You know, you mentioned prevention. Prevention means that the individual has to know what the warning signs are by definition, because by the time it happens, it's not prevention anymore.
You're right, and what I like to let individuals know is it's different for everybody. It's different amongst men, women, different amongst ethnicities, different amongst age. So what I usually tell people when it comes to warning signs is kind of utilize your inner Jiminy Cricket. If Jiminy Cricket's telling you that something is wrong, especially a discomfort anywhere in the upper body, and especially related to exertion. So anytime you're exerting yourself, for example, you could be walking up that same hill you've always walked up, and this time, you know, you're a little more short of breath, or you've got a little ache in your chest, or maybe even an ache in your jaw. If something is awry or something is different, that's a red flag, and that's something you should make sure you discuss with your doctor. And remember, we as physicians, that's what we're here for. So a lot of times people are scared, you know, I'm okay, or I'm fine. What we tell people is talk to your doctor about it, and we can kind of figure what's really going on at that time.
You know, you used a couple examples, you used some specific words and specific locations, but just to reinforce your main message, it's any kind of discomfort in the upper body, particularly with exertion.
It truly is. It's any discomfort, really what it is anything that's a change while you're exerting yourself. It could sometimes be as simple as an arm numbness as well. So that, again, could be a discomfort. That could be a warning sign that something's off. And make sure, again, like I stated earlier, discuss it with your physician. Would you say it's wise to take action on the first incident and not wait for a repeat? Wholeheartedly, and no pun intended. We've seen both ends of the spectrum. Patients who come in early, and we end up, catching them at the right time. We see people who wait, and they ignore their warning signs, and sometimes it can be too late, it can be fatal. And other times, what's really great is letting people know that reassurance is also a powerful tool, right? So you might have a discomfort, and you can go in, get it worked up, and find out that everything is okay. And that is also an important part of the process as well, so that you can go back to exercising, being active in your life, and realizing that this symptom might not necessarily be attributed to my heart. That's a really good point. I mean, you could make yourself worse by stopping exercise for no good reason. Exactly. Now, I understand the Tri-City Medical Center does heart health screenings. Can you fill us in about that? They do. It's really special, and I want to give a shout out to the staff. We have an A-plus staff that, what's really great, it's bringing individuals in and evaluating risk. We have to realize that we all have our inherent risks. Some of us have family history. Some of us might smoke. Some of us might do certain things. And by doing these, by utilizing these risk assessment tools, we look at such things as what's your cholesterol levels, what's your weight, what's your body mass index, which utilizes your heart versus your weight. We also have imaging components, non-invasive ways to assess risk. One of those is what's called a calcium score, utilizing a CT scan, a machine that evaluates what's your calcium in your heart arteries. And this is a tool that we as cardiologists utilize to help us assess risks. And from that risk will allow us to assess, hey, do you maybe need a stress test? Or do you maybe need to just do lifestyle modifications like diet, exercise? Do we need to tweak your diet? Do we need to, of course, and always stop smoking? And it's really important. One last question. Should people wait for one of those signals to get this screening? I don't think so. I really believe at any time these screening tools are relevant. And again, we've talked about reassurance, we've talked about catching things early. So these screening tools are really appropriate in that it allows you to have a nice conversation with your doctor to assess your risk, and it's never too early.
Well, Doctor, thanks for joining us. It's a lot of great information.
Thank you so much.
I hope people pay attention. This is serious stuff.
Thank you.
And thank you for watching. Now, next up, we will have Chief Nurse Executive Sharon Shultz from Tri-City Medical Center, and we'll cover some more heart health issues.
When it comes to your health, you want the best doctor, the best hospital, the best health care just for you. At a hospital with the most innovative technology and comprehensive care, including the Mazor Robotics Renaissance System, an innovation in spine surgery offered first in San Diego County at Tri-City Medical Center. We care for you and your family with kindness, dignity, and respect. You'll feel the difference the moment you arrive. Tri-City Medical Center, advanced healthcare for you.
Welcome back. With us now from Tri-City Medical Center is Chief Nurse Executive Sharon Shultz. Sharon, welcome to the show.
Thank you.
What I'd like to know first is, what does your relatively new affiliation with the American Heart Association mean to Tri-City Medical Center?
Well, we've had an affiliation with the Heart Association for our cardiopulmonary resuscitation and advanced cardiac life support classes for our nurses and our therapists over a number of years. But this is really exciting for all of us. We're very thrilled to be a part of the affiliation now that's going to provide, I believe, more timely education that we can use for our patients. We're going to have events and a lot of community education for people throughout all of the ages. And so we're very excited on that. And our goal is to become the lead for prevention of heart disease and strokes in the community, in the North County community, for many years to come.
And we'll get back to the education for the community. I'd like to end with that. But before we get to it, how does this impact your clinical staff?
It really provides them with a lot of information that we haven't had just at our fingertips. It also provides some guidance from us from the American Heart Association on different things that may be needed in our community based on assessments that they have done.
Would this be on the order of statistical type studies?
Absolutely.
So what can the community expect to see and when?
Well, we have a heart walk that's coming up next fall, but we just had, last week, we had the Go Red for women, which is our red dresses that we wear and our t-shirts. We're going to do a lot more healthy things for even our staff. You know, we have a path around our hospital that has different stations that you can work out at. And so we want to kind of bring those to life again so people get out and move more and really look at dietary and the types of meals that are served to make sure that everything's more heart healthy and keeps everybody a little bit more energized.
You know, I'm sure you've piqued some interest. So if people want to know more, what should they do?
Well, we have our Cardiovascular Health Institute at the hospital that they can call, and we'll leave you with that number. But they can call through our referral lines or stop by or look in the newspaper for our different events that will be held.
Well, I'm sure people are going to be excited about this. This is a very important issue.
Yes, it is.
And I want to thank you for filling in all those details for us.
Thanks so much.
And thank you for watching Community Health Matters. This concludes this edition of the show. Be sure to visit KOCT.org to view this and other KOCT shows as video on demand. Thanks for watching.